What's going on, guys? In just a second, we're going to flip over to an abdominal exercise. What I want you to pay attention to is the verbiage, aka the coaching cues. What I want you to take note of is that the words that you use are powerful. They can help a patient move in the right direction and feel the right things, or they can directly combat that. And a lot of times we don't even recognize that the words that we're using are combating what we're trying to have the patient execute. So for this exercise, it's an all fours lift, but it doesn't really matter. The exercise or any abdominal exercise should be very intentional with the cues that we use. What I'm referencing is having the patient push their belly button up until their hips come off the ground instead of just telling them to raise the hips. Think about a plank, for example. Usually, when we're going to a plank, we tell our patient to raise their hips off the ground or raise the knees off the ground. But what's actually working there are the hips. The abs aren't really working. When you make a subtle tweak, such as saying, I want you to raise your belly button in the air until your hips follow, that subtle change is one of the most powerful things you can do when it comes to coaching an abdominal exercise. What we've just created is a shift, a mind shift into how they need to perform that motion. It's not by driving the hips up, it's by bringing the rib cage up and the belly button until they're off the ground. What do you think is going to be working more when they go through those set of cues? The abs. So it helps patients feel what they're supposed to feel before they're actually into the motion. And this is an easy way as to how you can truly amplify your patient's results with any sort of abdominal exercise. So an all fours lift is a really great abdominal exercise. The thing is, the cues that we use can really be transferred to any ab exercise. The most obvious and common is a plank. Remember, the cues that you use are so powerful to really make sure that your patients are executing the motion in the right way, but also genuinely learning how to perform the motion. So with an all fours lift, all we're coaching and cueing are 4 movements. And those motions or movements are head down, chest up, belly button up, tuck the tailbone. So every step is ensuring that I'm not letting things compensate or I'm leveraging the abdominals. So let's go through it again and recognize what's happening. Head down. This is combating the neck. Usually, necks create shortened abdominal exercise times, meaning they complain of neck pain, so they cannot perform the motion. So how do we remove that? We put the neck in a position where it is disleveraged. It doesn't have an advantage point to try to work. And so that's with the head nice and relaxed. Next, we said chest up. This is protraction, and this is protracting the upper rib cage to get, yes, the serratus, but also the upper abs and upper obliques. Number 3, we said belly button up. That's further depression of the lower rib cage, typically known as the bucket handle. It's going to give us more obliques and more abs. And lastly, belt buckle to the chin. This is making sure we're not in an extension. Extension is going to leverage the low back, so we're removing that. And the belt buckle towards the chin is putting an anatomical motion in a language that is familiar to the patient. Most patients, I say most because I work with a bunch of kids and some kids have not worn a belt before. So in most cases, you're going to see that most people are familiar with belt buckles and most people know where their chin are, and all you're having them do is move the belt buckle towards their chin. Really simple cue. And then the final cue that we give is by telling them to lift their belly button up towards the ceiling and lift until the knees come off.
So we're not just popping the hips off. This totally changes where anything and everything has a fair chance to work. We are being strategic in pretending we're lifting that belly button and having the hips follow. That verbiage alone maintains that posterior pelvic tilt that we're looking for. Just lifting the hips usually pulls people into extension. And so the cues you just walk them through are all gone. So really familiarize yourself with those cues and really make your words intentional. The more intentional you can be, the better the outcome.